Welcome back. You're watching The Globe here on SABC News Channel. Thank you so much for joining the team. Now, the official global death toll from the COVID-19 pandemic has passed the 6 million mark. That's according to figures released by Johns Hopkins University. The university says of midday on Monday, the figures stood at 5,999,158. This as the pandemic enters its third year. The milestone is the latest tragic reminder of the unrelenting nature of the pandemic. Now, entering its third year, experts have warned that the disease is far from over. Remote Pacific islands whose isolation has protected them for more than 2 years now are just now grappling with their first outbreaks and deaths, fueled by highly contagious Omicron variant. Hong Kong, which is seeing deaths, is testing its entire population of 7.5 million 3 times this month. Death rates remaining high in Poland, Hungary, Romania and other Eastern European countries. The region has seen more than 1 million refugees arrive from war-torn Ukraine. Despite its wealth and vaccine availability, the United States is nearing 1 million reported deaths on its own. Experts say death rates worldwide are still highest among people unvaccinated against the disease. Well, to talk a little bit more about this, we're joined by health expert Dr Fundile Nyati, is the CEO of Proactive Health Solutions. A very good evening to you, and thank you so much for taking the time. As I mentioned, that when I last looked at data from Johns Hopkins, they'd reached the 6 million mark. So I want to look at the timeline, especially globally, and the importance, as we've mentioned, it's the third year. So the significance of this in terms of major infection deaths and, of course, control measures.
Good evening, Tsepiso, and good evening to the viewers. You've just painted a picture that's a reminder of the toll that this pandemic has had on humanity across the globe. Even islands that were relatively, protected are still, seeing huge numbers. So yes, it's a tragedy, but at the same time, we can say that things are looking much better than they were. We've got more tools at our disposal to try and mitigate the risk of this pandemic than we had, let's say, in the first year of the pandemic, that is from January to December of 2020.
I guess for me, the question is, when we look at the dashboard and when we started trying to figure out what was going on, where it's going, and as you mentioned that there have been different experiences from the different continents, whether it's the northern or southern hemispheres. But for Africa, what has been the experience? South Africa has had the worst of it. If you look at that global dashboard, at some point we were amongst the 10th worst affected country in terms of the infection rate. So what accounts for that difference?
Well, in terms of what's recorded, then South Africa is the worst affected country, in the continent. But at the same time, there's a school of thought that says the other countries in the continent don't have very good surveillance systems, and also the ability to test. Most of them struggled with the testing equipment and all of that. So you'll find then that the numbers that we are seeing may not necessarily be a true reflection. I'm talking about the other countries in the continent. So the countries in North Africa, Morocco, Egypt, and all of those with much better surveillance systems are recording big numbers, just like we in South Africa. We've got very strong surveillance systems and ability to test. So I think we need to look at these numbers, and know that they may not necessarily be a true reflection of what's happening in the continent. Having said that, in South Africa, we have had a huge number of people, just short of 3.7 million since the 5th of March in 2020. And just about 2 days ago, we were actually, finishing the 2 years since we saw the first case. So there is no country in the continent that has gotten to the level at which we are, which is 3.685 million. But what's even scary is the fact that in terms of deaths, we are just short of about 31 deaths. Just about 300. We're short of about 331 deaths to make 100,000 in terms of recorded deaths. However, when one also looks at what is normally referred to as the excess deaths, the South African Medical and Research Council has also been doing some analysis, and they believe that we are just short of 300,000 of deaths that were not necessarily recorded officially. And so when you add then this 100,000 that is official and the 300,000 that the MRC is talking about, South Africa then has lost almost 400,000 people from COVID-19. And that's a huge number of people that we have lost.
So you referred to the testing data and the importance of expert analysis and guidance. Just through the various variants, and when we, from a medical perspective, then we agreed that somebody has died from COVID-19 complications. How has that improved?
Well, I think one of the things that we can say is that, we had the original variant that came in, and then at the beginning of 2021, then there was the beta variant, and not long after that, then there was the Delta variant that originally came from India, or at least was discovered in India. And then we had the Omicron variant. Now, if we're looking at the deaths, we've lost more people from the first three variants, especially with the Beta and the Delta variants. But as far as the Omicron, that was again first discovered here, we haven't seen as many deaths. Yet, in terms of the number of people who are infected, we've reached the highest peaks of all the four waves. So what one can then say is that in terms of the first three waves, that's the highest toll that we had, and the last wave hasn't been that hectic. In fact, other people are actually describing the Omicron wave, Omicron-driven wave, as the pandemic of the unvaccinated, as far as the serious illnesses, hospitalizations, and deaths, because most people who were admitted in hospitals are largely those people who were unvaccinated, and those who had been vaccinated did not really get to the hospitals. So, and that's what we are still dealing with now. Most of the people who are dying, although the numbers are not so hectic anymore, but still the people that are dying are those that are unvaccinated.
So, in terms of genome sequencing, what we've understood about the evolution of the disease, and I want to particularly look at this against the backdrop of the various modeling we saw when this began and how it began to change drastically as well, that it soon affected our own planning and what we felt was best for not only at district level, but from country to country.
Yes. So I think one of the things we must be proud of as South Africans is the fact that, early on in this pandemic, that is around June of 2020, that is within the first 3 months of the epidemic, of the pandemic hitting us here, we were able as a country to assist in the setting up of, units or networks of units of experts that are in that space of genomic sequencing, in KZN, here in Joburg, in Cape Town. And as I speak now, we are actually one of the leading countries when it comes to that kind of science. Unfortunately, with all of that expertise, we live in a world where there are also other issues, geopolitical issues and stuff. And so when our scientists, have been able to identify some of these variants before anyone else in the world, that has actually been used against us, as a country. But that should not take away from the fact that we have some of the best experts in this country, because since the pandemic started, really, we have been monitoring, looking for any variants of concern, and studying them in terms of aggressiveness, how infectious they are, and all of that. And we've been the leaders in this space. So that is something that I think we must pride ourselves on as South Africans. And generally, I think we should learn from that and say, all right, we've been able to get global leadership in this space. What about actually getting to manufacture our own, vaccines, manufacture our own, antivirals against this kind of, viruses? Because right now, for example, there are 2 drugs, specific antivirals, that have been approved in places like the US, that are actually proven to work against, COVID-19. One of them has already been approved by our SAPRA. Now, the question is, why can't we be able to manufacture? So I think the issue of self-reliance as a country, we should really invest in being self-reliant, because we were caught napping. We never thought that there could come a time where we can't import things, as a country. And now we have learned from COVID-19. And so we need to make sure that we invest in our own scientists, we invest in our own manufacturing abilities. And I'm glad that the richest doctor in the world, who grew up here in South Africa, originally from Gqeberha, has actually come back to plow back in Cape Town to be able to help us to have a lot of capacity in the development of vaccines.
Okay.
So as a country, I think we're doing very well.
Before we run out of time, you spoke about vaccine hesitancy and how Omicron has been seen as a pandemic of the unvaccinated. And this is important just in terms of bringing it down to the level of people understanding what may seem like sophisticated to ingest, in our normal day-to-day. Yes. mRNA technology has been something that's been looked at greatly with this disease. But I want to talk about nuances and the research and development of that. When we look at South Africa, when we look at Africa, is there anything that will be unique to us, our people here, the environment, that would almost influence the development of further vaccination?
Well, I think one of the things we need to know is that when South Africa was, under isolation during the apartheid days, it was relatively, self-sufficient. We were able to produce a lot of vaccines here. However, with the opening of the doors, and the globalization, those companies that were doing that, they closed some of the local manufacturing capacity. So we have a history of manufacturing vaccines here in South Africa, and we were doing that up until 1994. What we need to do is to then, say, let's invest again. And I think our government needs to actually, put a lot of resources or at least public-private partnerships to make sure that we have that capacity. And in fact, not only for South Africa, but actually for the continent, there's at least 5 countries in this continent that have the ability to produce world-class, vaccines. So as Africans, we now need to put our heads together. We've got the best brains, in this continent, in this country. However, we're good enough at this moment to collaborate with others from other continents. Let's now invest and make sure that we produce stuff here, because this is not going to be the last pandemic. There are many more other pandemics that are still to come, and they should get us at a point where we have the ability to produce medicines and vaccines for ourselves.
All right. Thank you so much for your time. Dr. Fundile Nyati, he's a health expert.